Very well. Good afternoon, everyone. Honourable speakers, first of all, honourable colleagues, dear guests, participants. Thank you for this important event during a very important week, the European Mental Health Week. We didn't choose this week and this day by accident. It was on purpose because we feel, Maria and I,
So we feel in the field that there are a lot of mental problems, but ILVO, that's what Tom just said, made research and published in 2020 the outcome. And of course, it was evident mental health in farming isn't well. Yeah. And they found 7 stressors, risks. The cold, the heat, the climate, diseases, all those things are risks and can be a stressor for a farmer. It's also a demanding profession. They must not only be a farmer on the field, but they must also be an economist, a specialist in fertilizing, in manure. They must be a mechanic, an innovative technician, an accountant. So they need to have many hats before they can do their profession very well. And then regulations. Governments want to rule everything. In farming, that is not possible. You are for a great deal depending on nature. Farmers also have the impression that authorities decide everything above their heads. They have the feeling that there is no connection with farming when making regulations. Weak negotiation position. Farmers are price takers. That's a very, very difficult position. Financial uncertainty. Is it possible that I can pay next year still my debts, my costs? Uncertain future perspective due to climate, due to regulations or absence of regulations. This also has a very high stress. And then performance drive and appreciation. Farmers feel bashed. Everything is their fault. They feel themselves at the bottom of the social ladder. So these stresses, you can find them in a document of ILVO. I've put the link. I've put the link at the bottom of the slides. Of course, the document is in Dutch. And then, of course, now we know what the stresses are. What can we do about it? How can we get a positive work context? 3 things: removing the barriers to coping, strengthen mental health, and addressing the stresses. And of course, everything is related to each other. Addressing the stressors. I can give some rules. Simplify them. Hear them on the field. Make an impact study if you make regulations, not only on an economical base, but also take care of the mental impacts. Strengthening farmers, training, courses, and awareness of visitors. Farmers don't go much out of the farm, everybody comes to them. So visitors are very important to see if there are problems at the farm. And when they say signals, what can they do about it? At Farmers at the Crossroads, we have a special training for that, to give them tools, to give the visitors tools to start the conversation and to address them with special help. Then strengthen mental health. Yeah. Important and proactive work about mental health. And of course, encouraging the culture to talk. And how can we do that? By training tailored to farmers. It's not possible to take methods from regular care and implement them in agricultural sector. That is not possible. Spreading tools that can help them strengthening, and also raising awareness to the press, to the agricultural organizations, to the public. Third, removing barriers to coping. That must be on an individual level, on a company level, and also on a sector level. Very important is that the cost is very low. As I said before, Farmers at the Crossroads works for free. Our advisors, our psychologists, our freelance vets, they all work for free for the farmers. And that is because it makes them easier to come to our organization. Also, defining farmers as a vulnerable group. We don't have figures in Flanders about suicides or suicide attempts. but they have them, I think, in the Netherlands and in Germany. We think that it's about the same amount. In France, there are 600 suicides a year. That's very high. Then improving and strengthening organizations like farmers at a crossroads. It's also important that the farmers have one point they can count on. So here in Flanders, it is farmers at a crossroads. And then also important, make a link between healthcare sector and farming. And make sure that when there is a crisis on an individual and company level, they know where to go to. And on a sector level, for example, bad weather, by climate, COVID-19, when you make regulations, not only think economically, but also think at the mental health. But what farmers need to have a good mental health is in fact based on a few words. First of all, respect, appreciation, a fair price, and a clear vision for agriculture. Thank you.
Thank you very much, Els, for this kickoff that I think was quite, well, concise but very clear. I hand it over now to Dr. Tomás Russell and Dr. Louise McHugh of the University College Dublin for their presentation of 12 minutes. There you go. Thank you very much, and thanks for the opportunity to speak to you today on this. And also to Els and Farming at Crossroads, it was very interesting to hear that. And interestingly, we'll be talking today about farmer mental health and suicide prevention in an Irish context, but a lot of what you have just discussed has resonated with some of the work that we did. So I suppose it emphasises the importance of the work on the crisis. So I'm Tomás Russell. This is my colleague Louise McHugh from University College Dublin. And just to give a bit of context in terms of who we are, we both coordinate and manage the UCD Agri Mental Health Research Group, which is a grouping with myself. So my background is in agricultural extension and innovation around farmer behaviour change in the School of Agriculture and Food Science. And my colleague Louise is Professor of Psychology in the School of Psychology in UCD with expertise around behaviour change, mental health and mental health intervention development. And the team also involves more colleagues from the School of Agriculture and Food Science and also from the School of Psychology with particular expertise around farmer mental health, and we were established in 2021. So what we're going to talk today about is our own research, which we conducted in Ireland looking at farmer mental health and also related in a wider space to interventions and supports that we can put in place. So I think it's well recognised at this stage that there is a mental health crisis in agriculture, even internationally. There's lots of pieces of research being done around this, and we can see from some of the snippets up on the screen, lots of media coverage around the issue around mental health in agriculture. In the study that we conducted in Ireland, we found that 23.4% of farmers were considered at risk of suicide. So just under a quarter of farmers in Ireland are considered at risk of suicide.
And that means that in the past 2 weeks before we did the survey, they had thoughts of or urges to take their own lives.
And just in comparison to the general Irish population, that current figure, or that figure, is around 14.6%. So you can see it's considerably higher in the farming community versus the general population in Ireland. And we have seen from some studies and also from anecdotal evidence around Europe that there are in some countries similar types of figures around this. So it is at a crisis point and there is a serious issue. And I suppose one of the quotes that stands out for me from the research that we did when we published the findings, or put them out on social media, this statement came back: stark but not surprising. And I think that really stood out to me because what it says is people within the agricultural sector said, yes, this is stark, but not surprising. So there's a lot of anecdotal evidence out there that this is happening and this crisis is there. When we dug a bit deeper in the study, what we found is that farm stress is associated with higher suicidal ideation and lower well-being. So the driver for that suicidal ideation among farmers and that lower well-being is farm stress. And there's a really strong link that shows that that is the cause of it, as was touched on by Els and Farmer at the Crossroads, that this stress is a big issue in agriculture. And again, when we looked at what were the key stressors for Irish farmers, we found that number one, it was government policies designed to reduce climate change. Number two, outsiders not understanding farming. And number three, concerns over the future of the farm. And we will talk in a second in a bit more detail around the government policies designed to reduce climate change, because it's not really about the policies themselves, but more so around farmers having a voice within the development of those policies. But what you can see from this is that the concerns and the stressors, do relate to farmers not being understood, farmers being under pressure as a result of whether it's policy or the future or the fragility of the farm going forward.
So when we look at those stressors, we can see that first and foremost there's a structural piece to this, which is that there is big policies that farmers are perceiving that their voice is not heard in, and their voice has not been involved in. And there is things that can be done in terms of communication when we're creating policies, when policy is being created, that can include their voice and that can create recommendations, that can create initiatives that don't feel disconnected from the farming community. We need to hear and understand their unique motivators. If we're putting in rules, recommendations, like El said, to people that feel disconnected from them, and that's someone asking them to do something that they feel doesn't understand them. There's no trust there. We're not going to be able to see adaptive ways forward for that structural piece if farmers don't feel that they're included in the conversations around policies that directly affect them. So there is that structural piece, first and foremost, causing those stressors.
So I think referring back to the point I made previous about the government policies, and I think it is important, but that's where it's not just the policy, but it's actually farmers really needing a voice in it, and it not, I suppose, affecting their identity, the environmental stewardship, the fact that they are good farmers, and they want to be involved in the discussions and actively and meaningfully involved in those discussions around the climate change. So then on the psychological side, generally when you Google farm mental health, or when you talk to people around farm mental health, or you look at some of the research around farm mental health, this is the type of words that come through. People mention isolation, regulation, succession, rural crime, financial pressures, climate change, animal welfare, negative media perception, and the public perception as well. They're the type of words that we hear. And that's not an example. There's lots more that could be added to that list. But actually, there's a lot more underlying issues.
So when we undertook the study where we were looking at the nationwide survey, we interviewed people, we had focus groups with farmers and farm support workers. We also looked at what are, psychologically speaking, the underlying strains, the underlying causes, the problems with maybe coping strategies that for the farmers, aside of the structural side, which of course needs change, but that we can understand how can we really help farmers by having psychological interventions that are really going to target what they need. And what we were finding is these three elements, that the sense of purpose, with this changing environment, with this uncertainty over the future, with the changing level of respect for the farming community, that their sense of purpose and meaning is really being tossed around and changed around for them. And that's really having deleterious effects on their mental health. We see that as a coping strategy to cope with emotions and emotional regulation. The most common strategy among the Irish farming community is to avoid emotions, deny them, suppress them, pretend they're not there. But that is actually a risk factor for the higher levels of depression, severe to moderate depression, severe to moderate anxiety, and with its higher likelihood of the risk of suicide. So that strategy, or that coping strategy, is something that we directly need to target in the types of interventions that we develop that will help support them to be able to regulate their emotions in more effective ways than just denying them. And then the third piece is we saw that their sense of identity as attached to the land, that was more linked to higher levels or lower levels, of well-being. So really being able to try and change or help them to have a relationship with the land and their identity that is more flexible rather than rigidly focused, is going to be key and critical. It seems to be what underlie these other issues that we see at the top of the iceberg there, that we need to target specific things, psychologically speaking.
And I think the important point with this slide is that when you do talk to farmers, they will say isolation, rural crime, climate change. That is what's affecting them. But it's when we really dig down, and sometimes it's the same if anyone had gone to a therapist or counsellor and you talk to them about what's affecting you. It's where the expertise in psychology is able to delve down underneath that and really understand what's going on that might be related to those, what we might call surface level words, but it's actually a lot deeper.
So from our interviews, we've taken an example of one person. We've sort of de-identified them for not anonymity, but we've sort of extended out a quote from this person from the interview that typifies the type of responses we were seeing from farmers. So here we see Jane, the Irish beef farmer. Lang gets into the mind like on her own all day and thinking about it. Being a farmer is who I am. We see here that the attachment and the identity and the attachment to the land coming in here with this particular farmer and this profile that is linked to these higher and more substantial mental health problems. If you look at the media in the last couple of months, like we have been used as a scapegoat for climate change and all that. So Jane, in this example, and the farmers that we looked at and interviewed feel scapegoated by the policies around climate change. And that is putting a massive pressure on them and their mental health. We're nearly being hit with the stick that you have to fall into place and do what you're being told to do. There's an awful disconnect from what is happening in relation to rural Ireland. So here we're seeing that the farmers are feeling misunderstood by people outside the farming community. If we're setting regulations and we are people that we're seen as people that misunderstand them, or misunderstand the farming community, that is not going to build the trust we need to flexibly get people to adopt these really critical changes. And that's having an outrageous effect on the mental health of farmers. So here we're seeing that if we are putting huge pressures and overwhelming people at times of change and expecting them to then be able to adopt change, we're really putting them in a pressure cooker of overwhelm. It's impacting their mental health. And here we see, as Jane continued to say, people are toying with their futures. So there's this uncertainty around the future that is just adding to this overwhelm of uncertainty. And we humans, all of us, really do not like uncertainty. It is an emotion we really do not cope well with. We like to create certainty. And at the moment for farmers, they're hitting the front end of the uncertainty all of us are going to face about the future around these issues around climate change. And we really need to protect them and support them. As a farmer, you're expected to just get on with things as such. You're expected to be, I suppose, physically strong and mentally strong as well. Here we see that this is where we need to also not only look at structural change, we also need to support farmers to be able to be more resilient, to have coping strategies that are effective. So, not avoiding their emotions, give them a more flexible relationship with identity, the things that are really going to make a difference to resource them to be able to cope with this uncertain future.
So in terms then of looking a bit more into the evidence that we found and also the interventions, one of the more positive things that we did find is that among farmers, psychological skills are associated with lesser suicidal ideation and lower well-being. So what that means for us is that we can actually target the specific psychological aspects with farmers that we need to, and in turn that should reduce the suicidal ideation and improve their well-being. So we can look at approaches, and we will talk about them in a second, in terms of how we will target that and really work with the farming community to address it. So I suppose what we're trying to say here is if we want to save farmers' lives, we need an evidence-based approach. It's really important that what we do is evidence-based. When we broadly look at evidence and interventions, we can see that we can broadly put them under three categories: prevention, early intervention, and recovery. And in the prevention stage, we talk about information, help seeking, and promotion. So within here, there are lots of sector-specific support. There's lots of initiatives, there's lots of schemes around farmer mental health, and I just a very quick search listed some of them there. Some of these then are moving into the early intervention stage, and it's very interesting here on the farmers in the Crossroads, that's moving into that intervention and even into that recovery phase. So really important to have programs like that, but unfortunately they are limited when it comes to agriculture. So we can see in that early intervention stage that generally there's a lot of generic support in that. So people, and particularly in Ireland, been referred to call centres and supports that do not understand agriculture, that are very generic. And another really strong theme that came out of our research is really important that all of the supports are culturally appropriate so that they actually understand farming and they understand the farming community. And then finally, in the recovery stage, in Ireland, when we talk about just under a quarter of farmers at risk of suicide, these are farmers that that are in this recovery stage and need treatment immediately. They need to be supported. And in that stage, it's really important that you have clinically trained psychologists that's going to actually work with those groups of farmers.
So when we're thinking about a mental health crisis and trying to help people, and from the psychology side of this, we want to get people better faster. You know, that's what you want to do when there's a crisis. You want to understand how can we do this and get people better as fast as possible. To do that, and to do that with precision, we need to have evidence-based understanding of what works. What is the problem? What are we targeting? And what will work? We don't want to be aimlessly trying things. That's, you know, we're way beyond that with the crisis. We need to understand what is it we're targeting here. We want to precisely get at that in a culturally competent way with the farmers to make differences, tangible differences that we understand. Juncker did a review of all the mental health interventions for farmers in 2022, and they found 56 studies. But then when you look at it, and as they said themselves, where it's lacking is there's no rigorous evaluation of these studies, no understanding of what worked, what parts worked, what psychologically were we targeting, how can we make sure we could work it again, what didn't work, how can we really have an understanding of what we're doing and what we're trying to achieve here. They relied solely on self-report. They didn't have any kind of standardised psychological measures that we could understand what's happening from pre to post to follow, what's changing. They weren't using evidence-based protocols. They weren't using culturally competent evidence-based protocols or evidence-based protocols at all. And they didn't have process measures that would tell you specifically what to target. So what we're seeing is that these great initiatives, what would really help moving forward is for the rigorous evidence-based testing and use of evidence-based procedures will make the difference for these things to be carried forward more. See, you know, it's effective even for policymakers, for anybody. When the evidence is there, when there's the research there behind something and how it works, that is really important for things to be sustainable and to keep going and to be expanded, etc. So kind of wanted to talk a little bit about what that might look specifically. So in the study, and Dr. Alison Stapleton was a researcher with myself and Tomás on this project, and we specifically looked at what are some of the key psychological variables that are challenging for the farmers and why and where could we help them. Hayes and Hoffman did a study where they looked at a review of psychological studies and looked at what are all the variables that have been looked at in studies, and they had like 55,000 studies. And in 2021, they went and distilled it down and said, look, the things that matter to mental health and the places that we have to make a difference all kind of fall into 6 key areas that we need to look at. Motivation and meaning. And that is, you know, if somebody's disconnected from their purpose, what matters, what they value, what's clear, I'm being clear on what is it that is important to me in my life. Thinking patterns. It could be that overly ruminating, worrying, your relationship with your thoughts. The way you regulate your emotions. So how do you cope with emotions that might be unwanted, like anger or sadness or uncertainty? How able are you to change your behaviour when it needs to? How adaptable are you to change? How much are you stuck in old habits that are worn but can't find a way out? And how much are you able to change adaptively? Attention. How much is your attention just focused on narrow things? Or how much are you able to move your attention to what's helpful for you? And your relationship with yourself. It's the most critical relationship we all have. That relationship we have with ourselves impacts every area. And so when we did the study, myself and Tomás and Alison Stapleton, in looking at that work, we actually assessed these elements with the farmers to see where then, under each of these things that impact mental health, where are the Irish farmers having trouble across these targets, if you like, for evidence-based. And then we looked at these farming specific examples came out.
Yes, so to put them in an agricultural context so that I suppose when we're working with farmers we can start to figure out what's the type of language they're using and how we can link it back to that process and then eventually help through action on that. So for example, when we talk about the process of motivation and meaning. Generally, that's when farmers are talking about being scapegoated, and the climate change policies aspect of succession. When we're talking about the process of thinking, it's when farmers are ruminating about land or maybe worrying about the future of the farm. When farmers are coming to us maybe and they're uncertain about the future, the fear of the unknown, loneliness or isolation, that's around the process of emotion that we can work on. When they talk about rules being imposed on them for others, or reluctance to change traditional practices, maybe stuck in their ways, then we know we're trying to target the behaviour change aspect. When they're talking about love of the land, and this whole passion for the farm and land, which we see particularly with the farming community, that's targeting the attention process. And then finally, when we're talking about a bit more around identity, being strong and stoic, and that being important in agriculture, we're targeting the self in terms of the process.
So then in the Irish context, and we assume generally when it's assessed, when looking at this level of these targets, what we want to do in terms of interventions, psychological interventions to support farmers with these particular struggles is, under meaning and motivation, help clarify what is important to the farmer, what is important to them, get them back in contact and in touch with their purpose when they're not in contact with that. Help with thinking patterns, help with things like rumination and worry, help them have more effective strategies of noticing their thoughts, but not letting them get stuck in them. Help them with emotion regulation, to be curious as seeing emotions as things to learn from, not things that have to be concealed or denied or hidden from. Help them with behaviour change, to see that change can be about empowering and having your own choice and being empowered to move and change, rather than being sort of stuck in habits and that fear to change. And help then the development of their attention so they can be more flexible rather than stuck in and narrow when it is. And then finally help the farmers to have, broaden their identity, to not be just focused in on one limited set of labels of who they are, and broaden their sense of what it means to be a farmer, which is what they are. So we sort of saw the specific examples of how really drilling down and getting at the research can really show us things and insights that we might not have known what to target until we sort of did that drill in and really looked with this group, what is it specifically and what can we do from an evidence-based perspective. Moving forward, we think that, with this whole mental health crisis, when we look across from help seeking to early intervention, to prevention, to recovery, we really want to look at having research at the backbone of all of this. All initiatives have started. We really want to encourage that we will have research to understand what's working, when, for who, and how can we make things better, faster for the farmers that we're working with. Also, of course, as we said, we're not ignoring that. There is structural issues, and there are things like, when policies are being made, we really need to see that there is more effective communication with the farming community around this policy making. And we really need them to understand that their voice is heard and that their voice is being heard in terms of understanding what motivates the farming community, what is important to them about this policy change, etc. And then finally, when we're developing these interventions, we really need to make sure that they are, as I said, evidence-based, that they're culturally competent to the particular group that are being worked with, and that we've linked up thinking. So we really want it to be that, if people are working in help seeking, or if they're raising awareness and if they're doing a telephone line to get farmers somewhere, we want it linked up that where they're being forwarded to, where they're being signposted to, is somewhere that is giving evidence-based treatment that is actually specifically going to work for the farmer. So when we get that one opportunity that someone calls up, they go to a place that is most likely to work for them from the evidence. And then within that, we want to make sure that with that linked up thinking around resources, that we're going to embed them into scalable structures. And that will mean, being able to campaign to have, rural mental health teams that have people that are trained mental health professionals to work specifically with the farming community. And then to have sort of training within university programs and our psychologists who are trained to be clinical practitioners, to have training within that and modules that are going to be able to teach them to be able to work with the specific farming community and their particular needs.
So I suppose maybe to finish and reflect on some of what we said, farmers are unique. I think the farming community is, and certainly with this research we found that they're a unique community and a unique group compared to other groups out there. So it's really important that the policy and practice needs to reflect that. And I suppose a final point is that generally when a farmer is in mental distress and they call a line or they seek support, we generally only have one or two chances to try and support that farmer. So it's really important that wherever that farmer goes for support, or whatever avenue they try, that we have support that's going to be effective and that's going to work for that farmer and for the farming community. So thank you very much.
Great, and at the same time, eye-opening insights, I think. If I hear you speaking, and especially also if I see it how rudimental still in a way we're working around mental well-being. I mean, not rudimental your research, but what is out there and what is available there. I'd gladly like to pass on the floor now to María Gafo. Very happy to have you with us, Deputy Head of Unit of Social Sustainability in the DG Agri of the European Commission. You have the floor for 12 minutes.
Okay, thank you very much for organizing this event and for inviting us. It's really a very important topic, and unfortunately it's not very common to have this type of events. We participated, I think, 2-3 years ago in a similar event here in the European Parliament. And I think events like this one are highly needed. I came here to present you some figures or some elements of how we perceive the situation, and then also on the elements that we think that could be addressed through the policy. But I came also to listen, and I was listening very carefully to the other speakers, and of course I will listen after to the debate. So just to start about what is the situation, and I had the chance to talk to many farmers, and they really consider that it's a beautiful profession. So it's in close contact with the nature. You have the possibility to see the sunsets, to have the hands in the soil. So that's really beautiful. But at the same time, and I think the stress elements have been reported very extensively before, but I will name some of them. It's a very stressful profession. So in the first place, you have these financial uncertainties. You also have climate uncertainties that have been always there, but they are becoming more and more frequent now with this climate change, this drought. I'm from Spain. And I think it didn't rain for 3 or 4 months, and they are really worried what will happen this year. No? So they already asked for support on that. Also, there are high expectations from the society. If you remember during COVID time when the borders were closed and suddenly the people realized that they needed to eat, and then what do we do if the borders are closed? So I think the society became aware of the importance of farming, but at the same time, there is agribashing on behalf of some groups that, of course, can put a lot of pressure on the farmers. This in general on farming, and then about the situation in rural areas where most of the farmers live, is that the access to services, including social support services, mental health, etc., is not always very good, especially in the remote areas. And then also during the COVID, the access to mental health services were not always very easy in these parts, in this rural Europe, and especially again in this remote. The element of the succession, because often the farming it's a family tradition, can put also a lot of stress. So, for example, if there is a family that it's the 4th or 5th or 6th generation, and they see these difficulties and they see difficult to continue to pass it to the next generation, this can put a very stressful situation for the farmer. Farming also has this element of loneliness, isolation, which is a little bit unique compared to other professions. And many farmers work in isolated rural environments with limited possibility for having social contacts with other people. Also difficulty to have this work-life balance because the cows do not rest. So you need to work with them 365 days per year, 24 hours per day, etc. So this can put also an additional pressure. The other speakers already referred to this difficulty for them to speak about the mental health. It's a taboo in the society in general. In the rural areas, it's even a more taboo, and in the farming community, I would say that it's even more difficult. And this can put an additional situation of fragility, leading to stress and anxiety. Just to put some elements, some reports that we have carried out, there is a report by the Joint Research Center, which is called a study on the impact of loneliness on individuals' mental health. And then in this report, it is noted that the loneliness affects in particular the rural population, because the mortality of the risk of loneliness can be compared to the risk of obesity or smoking, even if we don't hear about that. There is a recent paper also by the Commission on this unwanted loneliness. And the persistent loneliness is further associated with unhealthy behaviors, mental problems, and also lonely individuals report more pessimistic judgments. And lonely and socially isolated people face the potential double penalty of suffering from poorer health and at the same time being stigmatized by the society. I want to draw your attention also to another report by the OECD in cooperation with the European Commission, which is called the Health at a Glance. And in a report from Europe, they assess the EU progress towards effective, accessible, and resilient health system. This report is published every 2 years, and it presents, I think, quite a good assessment about the situation across the EU countries based on the public available data. And I think one of the most important conclusions of the latest report is that the young people are disproportionately affected by the mental health problems in general, including also in the farming community. And in the farming community, I would like to refer to the young farmers, which is one of the key priorities of the Common Agricultural Policy. I think now we have only 1 out of 10 farmers which are considered young farmers, and in agriculture we call young less than 40 years old. In other sectors of the society we have a different age, but in farming, if we put a lower age, then I think we will not get any numbers. We have the objective to incentivize young farmers so that they continue or they start into farming. And we see that a lot of young farmers suffer from anxiety and the fear to fail, so not being able to continue with the family tradition, etc. Many of the elements were mentioned: climate, environmental, animal welfare standards. Also the high requirements of the farming profession, which is becoming a bit high-tech. I see some people nodding, so I think they understand what I mean. But at the same time, the young farmers, very often they have families. They have young families with children, etc. They need to find the school. They need to find activities for the kids, which not always are available, and this puts an additional pressure. So indeed, when we talk about the mental health in farming, we need also to consider the age dimension, which is an important dimension, and to consider this additional burden putting in the younger generations. On the elements needed to address this issue, of course, I'm looking forward to hear the discussion, but we identified some elements. The first one is the data, the evidence. We need further information in order to properly address this issue. So we are aware of some studies in Ireland, in France, in other countries, but we do not have the same picture across all the European countries. So I think this is an element that needs to be addressed. The second element I would like to refer is the need to raise awareness of the safety and health issues and to remove the taboo of mental health. Everybody talks when you have a pain in your knee, you talk about it, but when you have a pain in your stool, you don't say it. So I think it needs to be normalized everywhere in the society, but especially I think in rural areas and in the farming community. And for this, I think these type of events go into the good direction and are highly needed. And we also plan to address mental health. We have what is called the CAP network, the Common Agricultural Policy Network. So we will have coming an event on good practices on mental health across Europe. So we plan to address this issue soon. Looking at the Common Agricultural Policy, we believe that it has a role also to play in awareness raising between the farming community. Now we have a new element in the new CAP, which is called social conditionality, where farmers need to become better informed about their obligations for their workers, and we believe that this can also contribute to increase the awareness of the importance of ensuring their own safety and that of their family members. In the Common Agricultural Policy that we started this year, so it will be from 2023 to 2027, we give the opportunity to the member states to invest in the provision of services that will support and strengthen the farming community. So the new CAP is like a menu that we give to the countries with a lot of plates. And then depending on their situation, the countries, they use one plate or another. And for that, they need to do a blood test, a kind of blood test where they tell us the level of sugar, etc. It's a simile, but it's basically we need to understand what is the situation and then what are the plates that they take. And there are some plates that could support mental health, but of course it is up to the countries, depending on this assessment, to use them or not. And we have one tool which is called the Farm Advisory Services, where the issues of psychological support can be reflected. And the Farm Advisory Services will also have a role to play informing the farmers of their obligations. We have also one initiative that I don't know if you are aware, which is called the Long-Term Vision for Rural Areas, where we identified what are the challenges, opportunities in the European rural areas, and we look forward to put measures to have these areas in an improved situation in 2040. And then basically we identified a number of areas, including the provision of support services, including also on mental health. And this long-term vision for rural areas is holistic, so it goes across all the policies. It's not only in agriculture, because of course there is also the transport, the energy, and many other areas. And this is why also we are in close contact with other funds. So European Social Fund, the European Fund for Regional Development, where we want to improve the investments in the social support services in rural and remote areas in order to guarantee the accessibility of these services for farmers and agricultural workers, as well as the rural population in general, independently of their place of living. I would like also to refer to one announcement by President von der Leyen that she did in the State of the Union speech in the last September. So basically, we are finalizing a communication which is on the comprehensive approach to mental health. The publication date, in principle, it is foreseen for the 7th of June. So we are at the very end. It is based on a large consultation with member states, stakeholders, and citizens. And the focus will be on vulnerable groups, like, for example, children, socioeconomic disadvantaged groups, and it will address all sectors, including also agriculture. And the third element I would like to mention is the need to share and communicate good examples. Some are financed by us, by the Common Agricultural Policy, but some other by other funds or under national or regional policies. So I think it's always nice to share some good examples. And I will present 3 in Ireland, in Finland, and in Spain. So in Ireland, I know that they are doing a lot of efforts to support the mental health in the farming sector. And in the Irish CAP strategic plan, there is some interventions addressing the farm safety. There is, for example, one which is called Farm Family Online, farm safety training that has been recently launched to encourage farmers to change their working practices and be responsive to the potential dangers and take preventive actions to reduce the risk. And for this, they made a series of videos with about 50 farmers showing best practices, and they address also child safety and all the people safety. And what is, I think, very important is that these videos, these messages are recorded by farmers speaking to farmers. I think this is a much better communication tool than technicians or politicians talking to farmers. And I think it's a very, very good and successful example. Another example comes from Finland, and I heard some years ago what they call the 360 degrees loneliness. So basically you make a turn and you see nobody, because of course Finland is a big country with a very low population. And this, of course, it's a big element of loneliness. So Finland is very active in support of mental health, and I heard that they had a very high suicide rate in the past, and they achieved reducing it. And just to present one nice and small project in one town called or little municipality called Ramsau, to encourage joint activity on the one hand with all people and children. So they put the 2 age groups together, and there are exchanges, reading stories, passing on traditional skills like baking and crafts. And they also do board games, quizzes, brain teasers. And they did a poll with the older residents, and they felt a significant decrease in the sense of loneliness. So I think the project contributed to raise the morale. This is just a small project, but there are many, many nice examples across the European Union. And let me conclude referring to a program from Spain, which is called Viernes. Viernes in Spain is Friday. And I don't know if you know to what it could refer. So Friday was the friend of Robinson Crusoe. And basically, he was called Friday because on Friday, he saved his life. This project is financed by the Next Generation EU. And basically, it addressed the unwanted loneliness that makes many lives look like an island. And in this area, which is very, very much affected by aging and depopulation, they try to build on the strength of the community and in the intergenerational relations. So I have finished my presentation. I invite you to keep an eye on this communication on the 7th of June, and I thank you very much for your attention.
Thank you, Maria, and welcoming also Colm Markey, a colleague of ours in the Agriculture Committee. Maria, Friday makes me think about the weekend, in fact, rather than the story you told, but fair enough. I'll pass it on to you, Maria, for the questions asked.
Yeah, thank you very much. And just to give a short overview for myself, and something I want to give great credit to my colleague Tom, who came up to me, I think it was in Strasbourg, feels like a long time ago, far from a Friday, and asked to host this, which I'm super excited about. Any colleague across any political alliance, but in particular your own in the EPP family, that are coming to ask and pitch ideas around how we can tie in everything that Maria was just covering in terms of cross-sectional work. For me personally, and in everything I've heard from everybody, I think it's fair to say that mental health exists in all of us, and it's important, particularly institutions like the European Parliament, that we look at it that way. For me personally, I grew up on a small, what we call part-time farm. I think my father would only have loved to do it full-time. My mother not so much, but due to where we live and raising 4 kids, it just wasn't feasible. But he still tends to it every day, every evening, and the hour of the day that is required. Many of us in this room can only appreciate and understand that. Taking it a little bit closer within the realm of mental health, for me, I remember a local farmer, unfortunately, died by suicide, and I was in class with his daughter. And I remember at the time picking up from what Tomás and Louise were sharing. It was everybody knew about it, but nobody discussed it. And there was a weight of expectations to move through it without ever having conversations open up about it, if that makes sense. And I was really always taken back about how all the adults in the community weren't openly discussing what we can do next to help somebody else. So that really stuck with me. And then when you look at it into the niche specific area of agriculture, I think that is a case in many countries, not just in Ireland. What we do know, and we heard research from everybody, but taking in a little bit of a WHO report from 2021, the second leading cause of death right now for our 10 to 19-year-olds, which is our future farmers, is death by suicide. That's a statistic we can't turn our back on. When you look at the future of the work that we do, politicians, members of our civil service, our academic, and of course, as I mentioned, our farmers, then this needs to get real. And I challenge the point of the Commission, and Maria, with great respect. I think the issues with plates, and this is not to you and the Commission, it's to our member states. When you rightly pointed out and painted the image of the plates, I get that, but I also challenge that exactly how we prioritise young people in farming, so too should mental health be prioritised also. And that's the only way we're going to make sure our union, our 27 member states and growing, facilitates and supports mental health within that, versus leaving it up to the idea or the ideology, perhaps also lack of research and the academic supports behind that we end up with that disconnect. And ultimately it's our citizens, and particularly our young farmers, they're at the core and the end of it. I'm really excited to hear the drive on the mental health strategy, or what I hope it will be, and start off with. And we're hoping as MEPs, those who support our coalition and alliance on mental health here in the Parliament, folks like myself who work on it, but as a champion, Tom and Colm, who certainly a champion within our group, EPP, the next steps are making sure that EU mental health strategy is driven in all areas, particularly agriculture, as we are a farming party and many of their members, like Fine Gael, sits within this party. So long story short, because I went off on a tangent and I wasn't meant to, and I want to open up the floor to questions. Like all great things, it's always more comfortable for me sitting on a table full of academics, because all your hard questions can go to them versus politicians like myself, Tom, and Colm taking the heat. But this really wants to be interactive, and we have a good bit of time, I believe. Emer's doing our time check, so we'll open up the floor. I will ask you though for a name, just to give some context to our speakers, and if you are representing an organisation, please just let us know so that A, we can follow up, and B, we can keep in touch in terms of what the work you're doing. If you are working on something specific in your area in mental health, please also share, because rooms like this is where we network and we do that thing called cross-sectional work. So I think it's important that I highlight that from the start. I'll come back in and round up everybody else's thoughts, but opening up to the floor.
Thank you. I'm Hendrik. I work with the organization in Flanders for young farmers. Maybe to add on what Tom said on that the presentations were eye-opening. That's indeed correct. But then looking back to the numbers of the suicide risk, I think they're also shocking. Els said we don't have specific numbers in Flanders or Belgium, but when taking the ones from France, the ones from Ireland into account, it's definitely worrying. Being from Flanders, we are of course familiar with the organizations Farmers at the Crossroads. We were also involved with the mental well-being action plan by the Flemish government, and that was one of the incentives why we wrote the article Tom mentioned. Another one of the incentives, it's maybe a practical example. When we're having meetings with the members, with the young farmers, a couple of years ago when they were driving home, they told me, from the meeting, I have some new ideas, I have some fresh ideas which I can implement at my farm when I wake up in the morning. When right now, when we're mainly discussing new legislation, new regulation, they actually need to drive home to disconnect from all the information they're getting, because when they think it through completely, they would be demotivated in the morning to milk their cows or to start growing their fields. So I think that's already a first indicator that the mental health also of young farmers is under pressure, which leads me to two concerns. First of all, it was, I think, also mentioned by Els, the timing. When someone is experiencing some mental health issues, how long does it take to connect, for example, with an organization such as Farmers at the Crossroads? Do they do it in time, or do they wait too long until the problem is getting bigger? And then the second one is specific on the influx of young farmers, of new farmers for the next generation. When we notice that the mental health of the current generation is under a lot of pressure, how will it affect the influx of new farmers? Will it be an additional barrier, or is it? Not sure if that has been investigated yet, but it's definitely a concern of ours. And then maybe to end my intervention, Els mentioned the lack of a decent impact study on new legislation. That's something we fully support from our organization as well. We're actually working on something similar together with the Dutch young farmers organizations, which we're calling it the Young Farmers Check, where we would like to propose that any new legislation being concerned agriculture, nature, or environmental, that they would check a few parameters affecting the farmers to mitigate the impact of these farmers. And the parameters are definitely not only economical, where we have the known barriers, access to land, access to finance, the lack of decent income, but definitely also a social aspect where mental health should get a central place. So we hope to see that implemented quickly.
Thank you very much. Thank you. Any other questions from the floor? I have two in from online, but I'll go to them. We'll take a round in the in-person room first.
So, good afternoon. My name is Charles Dufour. I'm working at Schuttelaar and Partners. Like, if you want to pronounce it in the English way, we would say Schuttelaar and Partners. It's like a Dutch consultancy firm that really focus on the agriculture, of course, health as well, and digitalization of those domains and inclusiveness of women in the agricultural sector and sustainable development. So I'm here first to thank you for this opportunity to be part of you and listening to all your statements, which are very interesting for me and for everyone, I guess. But I'm also here to discuss about how can we encourage people and mainly women in the case of my company to continue to pursue their agricultural dreams, because after all, agriculture is also a passion for those people. And as it has been said by Mr. Russell and Ms. Martinez, farmers are unique. How can we encourage these people to continue? Because often it's a step that is real, but like most of women in general will take the agricultural sector of their husband, because their husband goes to retreat. Oh, sorry, I forgot the word. I'm French. This is why. But like, they cannot work anymore. So the women usually do it. It's for the majority of things. Of course, we count everything. We take everything account. But how can we encourage them to continue? What measures can we do? Because of course we knew some initiatives such as the Gender Task Force, and it concerns also agriculture. However, we see that we still need to go further. So how can we do it? And also my other point is about innovation. How can we help small surfaces to exceed more in innovation at good price? And of course, as it is mentioned in the EU Green Deal, we need to find a resilient and sustainable way of agriculture. I've been talking with my neighbors that are market gardener, and they just literally told me that because of their, let's say, they feel they're placed in category, as everyone mentioned it, and as they are market gardeners, they do not benefit of the same, let's say, we can say benefits and same changes for them as, for example, big surfaces of beef enterprise would have earned. So, yes, these are the points I would like to discuss. Thank you.
Thank you very much. Thank you.
Yes, hi, I'm Anna from the Federation of Swedish Farmers. And before I make my questions, I would also just send a small recommendation maybe for the policymakers at the table. In Sweden we have, and that's why I found the point on communication so thrilling actually. There are studies on how legislation and actually the wording on legislation is biased. We can see it here on SUR, for example, where there's been a discussion on what wording we're supposed to use on it. And of course, many legislations are biased on how you frame the discussion, even in legislation, on positive or negative notes, as a part of the communication. And there, of course, as policymakers, you play an important role in making sure that legislation is non-biased, even in the wording made here. But I wanted to ask, how do we make sure that there are psychologists that are specialized in farming? Because in Sweden, we have a problem with this. There are very few psychologists that are specialized in farming. I also wanted to know if you know of any studies that are based on gender. Because of course, as we heard, women in agriculture is often overlooked. And I just wanted to know if there are any specific studies on this.
We'll take those three, and then as I said, I have two from online, but we'll open up again. But I think three more than enough. Who would like to start? Do you want to take that last question in terms of gender, Julie, and then we can move around? Is that okay?
Well, I mean, in the mental health space, we did compare across genders in terms of mental health in our sample, and we did have 2/3 male and 1/3 female, but we did have enough females to look, and the stressors were the same among the three. The suicidal ideation was high in both, but it was higher for farmers, but anxiety was higher for females. So they were the pieces that were coming out in terms of gender comparison within our specific study. I know the issue around getting women into farming is kind of up in two places. That's what I think that's outside of necessarily psychology. But in terms of training psychologists, I think once we have evidence-based protocols, once we do the research to test that, we can then start to get that integrated into clinical training, counselling training program, where there can be a module, where there can be you just train the psychologist specifically in what this protocol can look like. So having the research to have specific protocols that are competent for this group is kind of the way to get that into then the training and education of clinical counselling psychologists.
And within that also, I think other groups of people that work with farmers, whether it's advisors, whether it's vets, whether it's people working in the agri shops or co-ops, it's important that they have a certain skill set, or at least have access to training for a certain skill set. And again, whatever we learn from this study, once we've established what the evidence says and what will work, we can then put that into training of agricultural advisors, not to the point that they're dealing with those that have severe mental health issues, but more around the early intervention stage or the help seeking, where they can be provided with nudges or different approaches that they can use really to try and support the farmer. Just on the gender question as well, and a small piece of research we did specifically looking at young farmers, male and female, and mental well-being. One of the key things we found is that for female young farmers, they find that they would know themselves their mental health as, or in terms of seeking mental health, they feel that if the male farmer cannot seek support, then they definitely can't seek support, because there's this, they're always trying to be the farmer, and the farmer's perceived as a male farmer. So for me, that was a really interesting finding from some of the research that we did, and something that we need to tackle.
And just to add, I take your note on phrasing from a policy standpoint. Kick back a little bit in the sense of we can get there, but we need more people running. From an Irish context, again, the best country I know best. Next year's are European and local elections, and what we know at a local standpoint, in order to impact policy from a very gender-specific, balanced way, which is what it should be, we need across all parties, including independents, at least 1,000 women to run. And right now, I don't even think we're hitting hundreds. So not the easiest of things to say, but I can tell you this from my perspective, working with both men and women right across the political house on mental health. We've lobbied hard for about 3-4 years on getting mental health on the table. That's why I always give credit to Tom, who came around this initiative. But that wouldn't have come if we didn't have people who were interested in specific social context issues. So not to answer it, but more just to give a little bit more context, and hopefully that get more and more involved. Yeah. Does anybody else want to come in on specifically? I like your young farmers check for the impact assessment. I can see a manifesto in my future, making sure things are checked. But I actually think it's kind of like take it down to a more recent, the COVID narrative that we're doing online. Was it COVID checked, and you have an approval rating, and I think that's a really important visual aid to say, have we thought about everything in the perspective of a young farmer again? María and Els, do you want to come in on any of the points, particularly on?
I would like to say something about the psychologists. We have 13 freelance psychologists in our organization, and they all have a link with farming. The husband is a farmer or a gardener, or the parents are farmers, so they know the language of the farmers. They know how what's going on in the agricultural sector. And that's very important indeed, because we always give the example of a farmer goes to a psychologist and he says, I'm very tired, it's all too much for me. And the psychologist says, well, then don't milk the cows 2 days. So that's, of course, that's not possible. And a psychologist who knows the agricultural sector won't say anything like that at all. And it's also very necessary that they know that the agriculture sector, because they need to trust somebody, and They need to know that everything they're telling, it's very important that they tell things, that they don't like to tell things, and they need to trust the other one. And if that other person, that's the psychologist, don't have a clue what's going on about farming, then you don't have a link, and there won't be any possible good solution there.
Yeah. No, Els, and thanks. And I, all of the stuff that you were saying is so in line with and in time with all the work that we're seeing. So I loved your presentation, and I think that one thing that was coming out in our research is the farmers were saying they would prefer to speak to someone who has the agricultural background. But I do feel I need to support my just in that I don't think any good psychologist would say, "Oh, the farmers," that would be very invalidating to what's in front of you. And I think in terms of the level of support that is needed and the level of the crisis, we still need to train psychologists to do this, because we might not be able to get enough people out there that would have their cultural background, that have the mental health training. Definitely with the advisor level, and definitely at the early intervention or the prevention phase. When it's coming to recovery and dealing with that, definitely has to be a trained mental health professional, obviously. So we do want to both have people who have the background, that's the ideal, but also still, even with everyone who's been trained, they're definitely, given the number of farmers in Ireland, certainly, they're definitely going to be dealing with farmers or all psychologists, and you kind of need it to be still for the training and that all psychologists to be able to work with the farming community, really, if we're going to be able to take on how big a crisis and how many of the farmers are currently suffering.
That's also what I said. There must be a link between the normal care and the farming. But at this moment, we need to lean on those 13 psychologists who know agricultural sector. I also want to say something between when they call to us, we can act very quickly. Certainly in about psychological help. Normally in Flanders you have to wait a few months to a half year before you get psychological help. That's not how we work. When they come to us, within a week we go to the farm and we start everything. We start the problems or the needs on about the company, but also about the person. So those psychologists we lean on, they can go very quickly to the farm, and they go to the farm. The farmer doesn't come to the psychologist. The psychologists go to the farm. That's also very important.
Maria, did you want to comment on it?
Yes, very, very quickly on this proofing element. We discussed it already. Actually, we identified in the long-term vision for rural areas what we call the rural proofing, so that the future initiatives have to look specifically into the impact on rural areas. And we identified in a pilot phase some initiatives that could be relevant for this purpose on behalf of the Commission. But then we think that also the national and the regional level, countries and regions also have to undertake this test. So we encourage them to do it in the context of what we call the Rural Pact. And a number of countries are already taking some actions into this. And then also a quick reply on this, how to encourage people, in particular women, to continue. So in the new CAP, we have one priority, which is to ensure a generational renewal. This is not new. So I think in the last CAPs, we also had this objective. We increased the budget, but I think one important element that we put forward now is that we ask countries to explain us their strategies to ensure this. Because in many cases, okay, we have some possibilities through the CAP, but there are also some other elements which are a little bit beyond our control, like, for example, access to land, etc. So we ask them to explain us how they want to address it. And in the case of women, for the first time in history, and it was also thanks to the European Parliament, we have one objective, which is to gender equality, including the participation of women in farming. So this is a new objective. In the negotiations on the CAP strategic plans, we ask countries to address this issue. It is new, so in many cases there was nothing included. In many cases also they told us that there was any problem, that this was a decision taken by the woman, that they didn't want to participate in farming. If this is the case, no problem, but of course if there are barriers, these barriers need to be addressed. And in the case of the Netherlands, I think it's one of the countries with the lowest share of female in farming. I don't know what are the reasons behind, but this is the fact. Thanks.
Thank you. Hence the reason why it's important to continuously fund research and innovation practices to make sure we're seeing true samples. Colin, I'll come to you. I just want to speak two questions that have come in that's been sitting for some time. So one being from Dr. John McNamara, who's online, to Tomás and Louise. Could you clarify the sampling methodology of your study? And where can I find a source of copy of peer-reviewed paper related to your study? And then the second was being from David Meredith in Chagas. What is the role of a farmer? What is the role of a farmer representative? Thank you. Organisation in giving farmers a voice in the design and implementation of policies designed to reduce climate change. And then, Colm, do you want to come in on your third question, and we'll do the round again.
And just to cover, I was going to make a comment or two, I suppose, and firstly to congratulate both yourself and Tom for organising this and all the speakers. And funny you mentioned just a comment from John McNamara, because I was actually going to mention John McNamara as one of my comments was in relation to, I think I missed some of the earlier presentation, but the idea of the need for stats. And I know in Ireland, around farm safety, John is responsible for generating an awful lot of statistics around farm safety and ventured into, I suppose, the whole mental health part as part of that. But I think across Europe there's a massive deficit of information about the impact in terms of stats. That's one thing I just want to say. The other couple of things I just want to say in relation to was, I suppose the whole, the point you make about the psychologists having the expertise. I think coming from a farming background, the relatability of the person they're talking to the individual, farmers can tune out very quickly if they feel someone doesn't understand where they're coming from and the context of where they're coming from. So the idea of having people specifically relatable to that, I think is very, very important. The other thing, just two very quick comments. The respect, I think there's an issue that certainly, look, I went home to farm when I was 17 and all my friends went off to college and I found myself quite isolated at the time, and I would say I've been that soldier for a while and it can be quite isolating. And I think the respect that farmers are often held in, their own self-esteem drops if the public at large don't appreciate the role and the importance of their role. So I think that's one very important thing that society needs to do, is respect the role of farmers and respect the contribution they make. The other, just very quickly, the conversation, and Maria said it already, everybody has to mind their mental health. And if we all respect that we all have mental health, then it's no longer to do. And I think that's something we really need to do. My question, finally, just in Ireland, I suppose, in the Irish context I have coming from, you mentioned the likes of the advisory services and the people that come in and farm. I think they're very important. But equally, there's a very strong structure of discussion group type scenario where farmers come together as groups and how you can leverage that in terms of peer support. I know Mark and a farmer would have done Make the Move, and I know there's a project up beside me called SAFE which looks at some of those sort of areas. But how do we make the most of kind of peer support? Because as you say, it's quite isolated business, and how, like, one farmer can probably relate best to another, and that early intervention thing, it can be done by a friend or a colleague just as much as it can be done by an external person.
Yeah. And those discussion groups definitely should be capitalised on, and that was what the farmers said, that the best place to put in stuff around prevention and get the awareness up is build it into existing kind of discussion groups, so you don't have to opt into it, that it's coming. Yeah. Sorry, Maria.
No, great. Do anybody wants to come in on the floor? Well, do you want to take any part of the questions, but John and David's in particular, and then finish off with Colm's share, and please come in just.
Yeah, I might start off with John. So in terms of the sampling strategy for our study, what we looked at, we had a survey, focus groups and interviews. So the survey, the sampling strategy was distributed to all farmers in Ireland through various sources, through the farm advisory services, public and private, through the IFA, Mock na Firma, the farm lobby groups, and through all those working in agri-co-ops, and vets, anyone that was engaging with farmers on a day-to-day basis, for them to distribute to their farmer clients, farmer customers, and it was also distributed online. So that was our sampling strategy on that. In terms of the peer-reviewed paper, it's currently under review, and I'm happy to send that on to John as well once that's done. To David's question around how the role of the farmer representative bodies, I think that was it, wasn't it? In terms of engaging farmers, I think they're really important to take the messages from farmers to bring them to policymakers. But I suppose what I would say, it's important that it's meaningful in the engagement with farmers, that it's using a multi-actor approach, that it's engaging all farmers to really understand their issues, and it should be that's the avenue in which they can bring it to policy to ensure that their voices are adequately being heard. And I know it can be complex with different agendas, different farmers, different groupings, but it is important that's all captured in a meaningful way. And there are really good approaches to doing that as well.
We have the report to the National Organisation for Suicide Prevention as well that has a good breakdown of the findings, who were the respondents, what type of farmers were they, where in the country were they coming from, that we can make available to John McNamara, and we have a preprint of the paper. So I don't know how we might share that with the
And then anybody wants to come in and column score?
Can I come in a bit more on that? Just in terms of the discussion groups, as Louise said, one of the findings we found is that, well, firstly, when you talk to advisors that are working with farmers, a lot of them feel like they don't have the skills or competencies to deal with an issue around farmer mental health. Some of them do, but it's intuitive. They've had no training. Now, there is some good initiatives. On Firm Ground is an initiative in Ireland which is looking at training advisors around mental health, and we are working with them, starting to work with them to ensure that the training for advisors is more meaningful and that they can actually have make sure that they engage farmers in the way that they need to. But outside of that, advisors would feel that they're not that skilled. Within our study, farmers identified that they would like the advisor, so someone who has expertise in farming, and the psychologist may be involved in that, so that they can have the both bounce on each other. The other problem with discussion groups is not all farmers are in discussion groups. It's actually a relatively small group of farmers in comparison with the total population of farmers. So it's trying to target all of those, what we might deem hard to reach farmers as well.
Anybody else want to? Maria? Oh, sorry, you're doing it.
From my side, just to say that I fully agree on this respect element that I also commented, and then on the suggestion to use the farmer groups, I think it's a good idea. I think if we have the possibility, I think I will share it in the context of some groups we have with member states and with civil society. Thanks.
Thank you. Just one more question. I'll come to you. One more question in from online to make sure our hybrid model is being used. And this is where I feel I'm a poor European because my pronunciation is never great, and Tom knows that very well. Maja Istinik. Do you think the CAP will also have to make changes to the social security of the farming population, as many people in agriculture work unregistered and do not have access to health and social services? A very incredible point, particularly those that come in on larger farms that we see coming in. Any other questions from the floor to add to that? Oh, sorry, excuse me.
Yes, I represent the Employers Association for Agriculture at European level, GEOPA. I'd like to address some of the most psychosocial aspects that were mentioned by Drs. McHugh, Russell, and also by Ms. Verté. You mentioned some elements, the need for respect, the need for appreciation or lack thereof, very negative image by media, very negative public perception from the whole of agriculture, and particularly of agriculture as a career, as a job. From our point of view, it is very much one of our key priorities and key concerns. It's obviously very, very, very tightly linked with the challenge of generational renewal in the sector. There are some elements that would like to put on the table on this sense, and especially looking at some of the relevant files that, for example, the Parliament is working on, such as the own initiative on generational renewal. Would like to advocate for key and concrete actions to improve the image of the sector, especially bringing or promoting the sector as a valid career option already in early childhood stages of education. Those are elements that we fail to see often in most policies. We believe that the image of the sector starts at the very early stages of our lives, especially for those who do not already live in rural areas. So that is something that would like to see not only in such initiatives as the own initiative report of the ComAgri, but also in the rest of policies, for example, from the European Commission. Perhaps as political group, you could also, my question would be, could you develop a little bit more if you have any proposals, if you consider any concrete proposals for the next legislature in this sense? And a little bit a separate question towards more like the Employment Committee. As I said, I represent the Employers Association at European level. One of our key roles is to engage in European social dialogue. And as a result of our social dialogue together with the unions, for example, in 2021, we launched together with the Agency for Safety and Health at Work, OSHA. We launched an online self-assessment, it's always very difficult, online self-assessment risk tool for the sector. One of the chapters is entirely dedicated to psychological risks at work for agriculture. And this is an example of the good work that social dialogue can bring to the sector. I say this because we are concerned about the current proposal by DG Employment to sort of stop their active support to the organization of social dialogue in Europe for all sectors, not only for agriculture. Would like to know if the Employment Committee is looking into it, if you're aware of this. We've been in contact with DG Employment to try to involve the political leadership on this, but that so far has been unsuccessful. So at the moment, we'd like to also seek the support and at least the attention of the members of the Employment Committee in the Parliament. Thank you.
Does anybody want, from any of those questions, does anybody want to come in? I'll pick up the ample question first. And we might have to speak bilaterally because I wasn't aware DG Ample or OSHA was coming off. We do a lot of work in the coalition and the Alliance on mental health, and one of them with Estrella Fernandez, and S&D in particular, are driving a more psychosocial risk directive. Term directive is causing some issues at political level, as you can imagine, given the fact that, unfortunately, I think this room would be looking a little bit different, maybe a little bit more packed, with different political leaders, more so than activists within the mental health space, if it was seen as a competency. That's unfortunate, but where I take that is we have a blueprint from COVID, and therefore we in terms of countries working together and health being at the centre of that. I know we have EU for Health in terms of the work there. So I think for me, mental health within that, and then psychosocial risk, be it regulation or best practice, be in there, and then in a further mandate, a directive comes. I can see a directive within that inside this mandate, but we have a very good band of support across all political parties for the Alliance and the Coalition to work closer together on making that a reality. So I might talk further on that, and then EMPL specific, I'll come back to you.
If I may follow up on the what our group can do in terms of agricultural policy and how we link it there. I think generally, you have a range of possibilities in a way. I think it could all start with us asking for better data collection and indeed backing up the research of it. I think that would be the least we could do. But this is something, and I'll then pass on the floor to the Commission, obviously, to respond to that, but also to Con. That is the first step, I think, because this is clear from what I heard, and we see it, that in Europe, solid data is lacking in terms of getting to know what we can do there. But then on the basis of, or on top of that data, you could start taking policy actions to either get and support organizations like the one of Els Verté in all member states and give basically a basic funding to set it up, or even a better funding to keep it going, Or you could, in the cap, indeed earmark some funds for social well-being. But I'll be curious to hear you speaking on that. Gender equality, for example, was one priority that is now coming in the cap, and I think that was a good step forward. But we need to move on and do more in terms of that stuff. Specifically to our group, the Young Farmers Check in the Generational Renewal initiative report is something we're trying to get in there. We also organize a Young Farmers Congress with our group, where we would be one to calling for a prize on mental welfare initiatives as well, because we're talking a lot about innovation there and material things, but we should be talking perhaps also about mental well-being. So there are a few initiatives that we can take, and they're definitely on our radar. Colm, I don't know if you want to add in on that.
Yes, just I think the point you make on the statistics, in the comments earlier I made reference to, I think it's very important. I also think perhaps from the Agricultural Committee's perspective, and indeed from MPL's perspective as well, I think we should look to get this agenda item between now and the elections in terms of the discussion at committee, with a view to maybe, look, I think anything like a non-initiative report, that is probably in the next mandate or whatever, but something that we could, if you have a conversation now that puts it on the agenda, it can open the door to something like that into the future. And it'd be great to come across, if between yourselves particularly, but across the two committees, if we could bring some joint initiative forward within the committees in the short term, with a view to something maybe bigger further down the road. Because I suspect, like, to do something like that would very much highlight then the issues like the statistics and things like that. But if we could get that conversation informally at committee level, and then from there maybe have some kind of an appropriate report in due course, I think would be a good thing to do.
We're working on it from a coalition alliance, to try and actually bring in envy too, so that we break down a little bit more of the barriers in terms of climate too. But great point.
Maria.
Yeah, I can reply to the question related to the respect of rights. So for the first time, we have this element which is called the social conditionality, which is basically a linking the cap payments to the respect of certain labor standards. It's the first time in history that we have this in the cap, so we are in a kind of pilot phase. We ask countries to do it at the latest in 2025. We have 4 countries that will start already this year. So this is France, Luxembourg, Italy, and Austria. 2 more countries in 2024, Spain and Portugal, and all others will come in 2025. The list of labor standards is limited for the time being, so we have some EU regulations, but then of course this is something that, depending on how it's working, probably is something to be enhanced in the future CAP, for which we already start thinking now.
Do you think there's room for something like this in the future CAP?
Of course, it's we just started the preparation, but I think normally when you have one element entering into the CAP, in some cases, of course, in the next CAP it is taken away, but in many cases, of course, it is strengthened. And I believe that this respect of rights is a very, very important issue. And we are also launching a study to have information about the working conditions across the European Union, because we have some studies in certain countries by some organizations that we want to improve the knowledge base in order to base our future policy also on this outcome. And in the CAP also we have some provisions to further look on the development of the social conditionality. As I said, it's something completely new. We work with it in close cooperation with our colleagues from DG Employment.
But I think Hendrik, am I pronouncing correctly, Hendrik's point earlier on the impact assessment, I think this is where the importance of social and economic, but social in particular, when we look at policies that we're constantly bringing in mental health even from there, so that we're not, so it makes it easier for us to argue why CAP should have some ring fence for mental health research, as well as supports on the ground, like one from Brian from your perspective, or the initiatives that you guys will have from the suicide prevention. Any other questions? Yeah.
I'm Lut Dont. I'm the Vice President of the Farms and Flanders. I'm a farmer. This morning I milked my cows. I think the most important thing of all this is that the farmer don't get problems with well-being. He don't come to the point that he has problems. And this is it is very important that at any time we talk with farmers and not about farmers. It's the most important thing, I think. Then we trust what the policy, then that's very important that you talk with farmers. That's what I wanted to make.
Yes. Hi, I'm Bronwyn from Compact Rebecca, and thank you very much for a really good discussion and really interesting reflections through this afternoon. But I keep reflecting on the comment about plates because I think it highlights the issue that there's this trade-off because you can't end up choosing all the plates. And I'm sure that all the blood tests that come back will actually highlight the fact that I think the majority of member states will have need to address mental health and then also gender equality. And unfortunately, there's always limited resources, limited funds. And so the priority of those, like mental health, always gets pushed down to the bottom of the list. So maybe just a general question on how do we take what we've heard this afternoon to ensure that mental health is prioritised, and perhaps also to maybe if you're able to like expand on if you're having discussions with member states and how, if they're interested in the work that you're doing and maybe like how they plan on working to improve it or like some of the results that you have. And then I just wanted to share one maybe like a good example from Wales, the DPJ Foundation. They are a charity working with farmers in Wales, and they sound quite similar to Farmers at Crossroads, where they help put farmers in touch with counsellors. But another thing that they also do is you can bring them up and they're just there to listen, because sometimes that's also important, that you have someone that understands and also able to listen at the end of the day. Thank you.
Thank you very much. Everyone come here.
Well, I mean, I think that what the hope would be to push this to the top of the agenda is that, given how overwhelmed farmers are and given the level of crisis that, you know, it was 55.5% in Ireland that were severely moderately depressed. If we think that people, we just leave that there and we think that coming in with changes and regulations with an already overwhelmed group is going to result in them being able to adapt to change, it's not going to work, you know. And, you know, I think like, you know, it has like a bucket and there's lots of water in it and when lots of certain things are in it and when the thing is full, one drop can push you over the edge. Whereas what we need to take some of the water out so that the farmers are going to be able to adapt and change to uncertain futures and to all the policies. So I would say that I think one thing is that it will impact everything else if we don't sort of, you know, really take seriously the mental health crisis.
Any other points?
I would like to, and I'm very happy that you say that, because indeed listening is the first thing we do. When they call us, we take all the time that's needed for listening. They want to be heard. And only after that you can work on the problems after they were heard. That's very important. And our advisors are trained in that, and sometimes it happens that when they go to the farm and it takes 2, 3, 4 hours or more, and all they did was listening. And that's important. That's very important. So you're right.
Just to add, and perhaps if you have no other questions from the floor, we can wrap up. To your point, I think you're all. I think as MEPs, we are fundamentally responsible in terms of policy and making sure when we draft, be it in our individual committees or that cross-sectional conversation is incredibly important. That we're doing so with, as you rightly pointed out, with farmers, not just about them, or that conversation. They're not at the table, essentially, which is quite ironic, considering they feed people as they sit at the table, which is an important point to acknowledge. So I think as policymakers we have an active role. I think as even farm organisations, large and small, as consumers, we need to have a better understanding about where food comes from as we move further into a food security and we're at crisis point. Actually, I don't even think we've seen crisis point to the extent of what we will see if we continue to not address the nutrition devaluing that other communities and countries are facing, in that we turn to farmers to feed the world. And the blame game continues, and you see that in the media, you see that with large organisations, particularly about farming, and then I think that's where we're at right now, even with this week in policy, that this us and them now out of control. We're ultimately, I know from ourselves, a bit biased in here because we're obviously EPP led, is putting the brakes on it, having that impact, social and economic, as well as environmental impact assessments, and that we're sharing the information in good time so that people can come back and they feel valued, not of devalued. And that's an incredibly important point that I think we will take from this conversation, if I'm fair to say, Tom. We covered so many different points in terms of the Young Farmers Check, in terms of women in innovation, and I have to say it's great to hear. In Ireland, I don't often at agri events, it's not often female focused at multiple layers, particularly coming from the opposite gender. So I say, as a young female farmer, my father reminds me quite often that I have no executive power because I'm off in Europe creating issues for him. So, but it's fantastic to hear so many that not to age here, but to hear younger generations, specifically in power positions that you are in here in Brussels and across the EU, that are making them an agenda point. I really want to stress the importance of that, and to have multiple young farmers represented in terms of and the organisations that you all represent. I'm super grateful to be a little bit Irish, if you don't mind me for a second, to have University College Dublin here as a leading expert in research, and it's fantastic to have Tomás and Louise. You know, and their statistics made big headlines, and the info and the data that they found, and I still scratch my head as why didn't anything change the day after people read the fact that we have just under 24%, 23.6%, right, of farmers feeling that suicide and death by suicide is their only option in the immediate term. And that's a stark but not surprising, to paraphrase somebody in your report, that's a stark and not surprising statistic. And I have to say also, to call it out, because I think it's important to do so, that's just what we know of. From an Ireland perspective, I can tell you this, I can guarantee, cheek of me to say that in front of academics, but guarantee that there's many deaths by suicide who is not calculated due to family requirement or due to what is discovered by people, and that's a real sad reality. And again, back to the point that I shared at the outset, our second leading cause of death for young people is death by suicide. And you heard a lot of numbers and a lot of statistics and a lot of great information about our ag community and the mental health of our ag community. But ultimately, I don't want to sit with you next year in EU Mental Health Week and discussing more horrific statistics, and that's where the urgency comes in from us as a party, as politicians, from the Commission, and then from organisations that are represented. So there is a lot of goodwill. I think it's really positive. I think if we had this conversation 5 years ago, I don't think we would have had so much research. We would have had nothing. So that just goes to show, but we don't have time there. And I really hope that you will all champion making sure each representative, be it as a candidate or a successful candidate in the European and local elections and national elections, make sure mental health is checked, and that we're not losing time and spending another few years trying to drive this up, and that it's very much at the forefront of the next CAP. I can guarantee you from my side it certainly will be. Tom,
Maria,
over to you.
Yeah, thank you so much. I was very happy to be able to do this with Miss Mental Health of the EPP group, as I would call her, because
I don't know if that's a good thing.
I'll say it's a good thing. No, I think this is exactly why this is also, from a policymaker's viewpoint, this is an interesting one, because it's divided between agriculture and EMPL in a way, and making that bridge between the two policy areas is an important one to do. It shouldn't be only about agriculture, as mental health should not only be something about other policy areas in which we're working. That is also why consciously we made the choice to work together on this one. In agriculture, I have the experience that whenever we organize events, the average age of attendance is above 55, even above 60. Quite often, I'm very happy to see today that the average age is in fact well below 55. But it's quite telling as well. It's quite telling, I think, not only for who is aware of this and who is paying attention to this more than others, but perhaps also quite telling in our political family that it has to be the youngsters that are dealing with mental health and agriculture as a topic. So I see it as our job as well to be putting this on the legislative agenda, because in terms of agriculture, the European Union has been regulating way too much in a lot of stuff, but clearly we have not been doing way enough in this area of agriculture. So I think, and I'm reaching out to you also, Maria, I think it is our job now to do something about this and to work towards the next CAP, to put this on the agenda in a credible way, and indeed make sure that we're not here again in 10 years' time. Well, I might not be here again anymore, but that we're not here again in 10 years' time to say how much of a pity it is that we haven't been doing more. So thank you all for being here. Thank you for your time, spending your afternoon in the European Parliament. We try to make the room as cold as possible, but still it's still a warm room. Thank you to Maria, to Els, to Tomás, and to you, Claire, for being with us this afternoon. Louise, of course, for being with us this afternoon and for making this a topic that can actually be discussed in the European Parliament. Thank you.